And welcome back to Ask the Doctor. I'm Mike Berger. Here to answer your questions about aesthetic surgery is Dr. Robert True with the True Aesthetic Center. It's a leading facility in cosmetic surgery as well as age prevention and associated therapy treatments. And we're going to start this segment off with an email question. This is from Kelly in Lancaster. I've lost a lot of weight, but still look a little baggy across the abdomen. What can you do for me? I think a lot of people have that problem when they get a little bit older. They want to know what you can do.
Absolutely. It's a very common problem from weight loss. It is also a problem from pregnancy, prior pregnancy, where women have extended on their stomach with the pregnancy, and then the baby's gone. They have a lot of bagginess there. Some of them have stretch marks, or some people who have lost weight have a similar type of thing. The only way to really take care of that is to remove the excess skin, but you want to do it in such a way to make it have a beautiful body. Most of the people that do these kind of procedures with me are women, and we do some men, but particularly in women, we like to contour the body. Women like to have a nice, beautiful waist, so we contour the waist with liposuction first, and then we also contour the abdomen too. Make it flat, flat, and flat here. Then we stretch the skin down. Stretch it down and cut off the excessive skin and try to make the incision as low as possible. So the result is they have a very nice thin waist here and very flat stomach. Now, one of the things that makes the stomach really, really flat is something we call plication of the muscles, where the stretched out muscles go right to the middle, and we plicate them or suture them together so that the woman and the man can have a very, very flat stomach. Boy, it looks great. They love it. They feel good about themselves.
Almost like getting a six-pack, huh?
It's almost like that.
Let's take a look at some of the pictures. Now, we have some before and after, and again, you can talk a little bit about this, Dr. True.
Well, here's a situation where the sides are kind of chubby. The lady has a little bit of a muffin top, and the waist is not as thin as she would like it to be. So what we do is and here's the tummy. The tummy has excessive fat. It's got some looseness of the skin, maybe some stretch marks. So what we want to do, we want to first contour them, contour it with the liposuction. And you can see how the waist is nicely contoured and the muffin top is really reduced, and also on the belly. If you look at the after on the belly, we have a flat stomach, flat belly. The muscles are plicated together. Boy, and it looks good. We do all these procedures at our surgery center, which is a AAA-HC accredited surgery center. We do it in a different fashion than traditional tummy tucks. With traditional tummy tucks, the underneath tissue is undermined with cautery, and it burns a little bit, and that hurts. With ours, we don't cauterize. We don't have to remove the vessels. The vessels all stay intact. So we can do this procedure with contouring without any disturbance of the vessels and the circulation there. So rarely do we have a problem.
Now, every once in a while, you'll say something and a question pops into my mind. So we were talking about women who have been pregnant and have had children. Can they do this? Will this reoccur if they have another child?
Well, of course, if you have another child and it all stretches out again, it can reoccur.
So you should have the children and then do this?
Yes, that would be the best thing to do. Yes, absolutely. That would be the best advice.
Just a question popped in my head. Here's another question. Speaking of, Lisa in Mesquite asks, what happens during an awake tummy tuck? And we talked a little bit about that now.
Yes, when the woman comes in, first of all, we do some photographs. We start a little IV, and we give her some mild sedation. Then we numb up the area with tumescent fluid. Tumescent fluid is basically a combination of lidocaine and epinephrine. It's got a little bicarbonate so it doesn't sting so much, but we infiltrate the area. The person's awake, a really minimal discomfort. They feel a little bit of poke down here, and that's it. But after it sets, the whole abdomen is totally numb. It's totally numb, and we can do the procedure. We do the liposuction next. Do the contouring of the waist, get rid of the muffin tops, make this as slim as we can as far as the fat, but I want to make it smooth too. The next step is to remove the excess skin. The result is they have a flat belly. The plication of the muscle is included in that. So when we suture the area there, we try to make it as low as possible. The nice thing about this is the woman or man is not laying there flat all the time. In between each one of these little procedures, the person can actually get up and go to the bathroom and come back, and we do the next part of it because it's all done while they're awake. It's pretty amazing.
So they can take a look and say, yeah, maybe a little more here, a little more there.
Perhaps.
Another question for you. Tracy in Midlothian wants to know, what's the recovery time for a tummy tuck procedure?
Of course, everybody's individual whenever you talk about recovery time. Some people do fast recovery time. Some people take a little longer. But on the average, I would say most people can go back to work within 5 to 7 days. You're up and at 'em the next day because you're not put to sleep. You don't have to recover from a general anesthetic. It's a wake procedure. So the recovery is quite rapid. In addition, because of the fact we don't do a lot of cautery or cutting of the vessels, and we keep all the vessels intact, you don't have all that tremendous pain like the old traditional tummy tuck. So people are able to go back to work quite rapidly. In addition, the way we do the technique of the stretching of the skin with this type of abdominoplasty, the person isn't really bent over as badly as the old traditional type of tummy tuck. So they get a quicker recovery. Works really good.
So somebody has this procedure and they're literally out the door that afternoon or morning or whatever, right?
Absolutely. We do the procedure, say, for instance, in the morning, and they usually go home somewhere around 2 or 3 o'clock in the afternoon. It takes about 5 hours to do the procedure because there's several different sections that we need to do on the procedure, but they literally could walk out the door and they're up and at 'em the next day.
Again, Dr. True, thank you so much. I'm Mike Berger. Have a wonderful day.